Hi guys, welcome to Her Health, Her Journey. Today we have a very inspiring guest with us. She is an avid traveler and yes, she had a baby recently. Her pregnancy had a little complication. However, she managed it beautifully and is awe-inspiring story we'll get to know from her. Hi Priyanka.
Hi,
So tell me, how are you now and how's life with a newborn?
fabulous. Just can't get enough of it. It feels like a blessing.
Fantastic. So, your first pregnancy, we knew you had complication around 7th month. You were diagnosed with dengue. How was it at that time? How did you feel? What was it? What was going on through your mind?
Honestly, now I am very much thankful to you, but at that time it was like, we were very much scared because the thought of losing your baby, obviously. But then, all thanks to you, we were, and you know how desperate I wanted a full term baby. So, those next 2 months, I was like, what if I get a preterm baby? And what if the baby is not growing properly or so? But then, yes, that was a phase. But then I was honestly very much confident that you are going to help me through it, and you know now.
Yes. So I remember 5 days of fever, not getting treated by your paracetamols, and we were scared. And I had called you every day here, and we were supposed to get admitted, but you being you did not want admission, and you were managing at home. But good, you followed all my advice to the T. And after 5 days, I think the fever subsided, and we came back on track.
There was too much back pain after that, almost for like 15 days, maybe post the dengue phase, and then getting the NTA done and scans done on regular basis was a bit daunting. But then, obviously, for the sake of the baby, we had to keep a tab.
Yes.
So,
I remember telling you, counseling you that we may have to deliver the baby early, but good that we were already in 7th month.
I
So,
remember after the appointment, I went home and cried, and then Dhaval had called you that
yes,
she's crying.
she's crying.
So Dhaval told me the same thing. The doctor is telling we might have to take the baby out in case if there are any complications, and the baby will be better growing outside.
Yes.
So, but then
Yes.
you told us that you would be giving us enough time. So
Yeah, your resilience worked. I know, matlab, you were so confident that no, my baby is gonna go till full term, and that's where it gives us as doctors also a lot of confidence to wait. Because if you are scared and if you are very skeptical, so that puts double pressure on us. But
for
because of
us,
your
it
confidence
was
and your trust, made me take that much risk factor with you. Okay, we can take that calculated risk, we can wait on to it, so that trust helps a lot.
in our case, it was the other way around. We saw that you were confident, so it was like, now if you doctor is confident, then obviously, you know better, you are the best.
I know. Then after 8th month or something, because that 7th month is when you were planning your baby moon photo shoot and your pregnancy shoots, and I cancelled all of that. So 8th and 9th month is when you wanted to do it. Please let me do it, and I think you have beautiful pregnancy shoot that you finally got to do.
See, it was honestly because of you that I enjoyed the entire term. The day we found out, and then I told you why I came to you. So, till the last year, honestly, dengue was a phase जहाँ पे थोड़ा we were ऐसे scared, but then I enjoyed my entire pregnancy just because of you.
Thank you. Now moving on to the happier part. So you are an avid traveler. You traveled before also a lot. And pregnancy, of course, your plans got halted because of dengue. But I think after delivery, you've traveled. You traveled the entire length of India in 6 months of your delivery, right?
See, I'll tell you. In fact, when I used to come, now you used to tell me you need a break. Weekend day jao, because no doctor has ever told me this thing that you need a break and you go on a vacation. So basically, you believed in us. You told us what measures we are supposed to take while being outside. So even our baby moon was so good because you had told us what supplements I would be needing, and basically खाने पीने का ध्यान रख के it was just perfect. And even after that, We traveled with the baby inside. We didn't even know what the baby was like, and also when the baby was in our hand later on, we never felt scared. Yeah, say how we will manage.
How many trips did you have in this past 6 months after your delivery?
See, my baby is 6 months and he has been to 5 states already.
Excellent.
So,
That's fantastic. You went to Mahakumbh also, right? You
Yes.
drove down to Mahakumbh with 4-month-old. How was that experience?
we were like, see, over prepared. When he was not born, we were like, he will be colicky. What if he doesn't sleep? And prepared for the worst. And then it turned out he is an like totally easy baby. So even people at home were not confident whether we should go or not. Obviously, even at some point we felt that too much crowd and what if we are not able to manage. But then the supports me and he was like, "हो जाएगा." And he is totally hands-on husband and father now.
Pointers for all the parents who are thinking of traveling with a newborn. What extra
See, the
care?
best time now since you have started solids, I feel the best time is before 6 months because you are the food. So wherever you are your baby, like, ठीक है, just put on that feeding nursing cover and you are good to go. So no need of sterilizing the bottles and maintaining the hygiene and everything is difficult. So until the baby is,
On exclusive breastfeeding.
yeah. So good to go.
But all the long distance travel, your baby was all good. Did not have a cranky episode. You didn't. It wasn't overwhelming for you.
Not at all.
Sleepless
In
nights
fact,
with travel.
no sleepless nights. In fact, we were like, इतना ज़्यादा travel हो रहा है, and we were traveling at night also. So we were like, maybe he won't sleep in the bus and all. But then he slept. In fact, once we were done with like after taking the dip in the comb, and we were at our room, I was totally exhausted. I had this headache, and I was like, उठना तो मुझे ही पड़ेगा. Dhaval, what will he be able to do if the baby needs to be fed?
Yeah.
So I was like, I don't know how I'm going to manage. But then even he was trying, he slept the whole night. So
Excellent.
hi,
Yeah.
balance.
So I remember you were very keen on full-term vaginal delivery, but because of dengue, our plans changed a little, and baby had distress. We did reach full-term, but baby had distress and had passed meconium, and we had to go for a cesarean section. But tell me, postpartum, because of the whole dengue episode and the recovery and all that, how difficult was it to get back to your feet post-delivery?
See, if now someone is going to ask me what is better, I would say go for C-section. Honestly, initially I was like, yes, I want a vaginal delivery and all. But then, when I heard that beep, beep, beep going on, and I got to know that the baby's heartbeat is going down, so it was like, now I want my baby out. So, and I know I tried my best. I was in labor for like 6 to 8 hours, maybe. Yeah.
Yes.
So I tried. So I don't have any regret. And next morning you came and told me just get up and walk. Try walking. I did, and after that I did not feel anything at all. It was like एक टैबू जैसा बना के रखा है that your back is going to hurt and the first walk is very difficult. Maybe it would be for someone, but then for me it was like no, it went so smooth. Later on also I was hoping that कुछ होगा, but then nothing happened at all. So
Yeah.
I enjoyed the postpartum journey as well.
Yeah, but you were an ideal patient. You listen to every advice, that drink sufficient water, make sure you're lying straight and you're not sitting for a longer period, and all that also helps.
I was very excited to have a baby. मतलब ऐसे the moment initially I was like partying and having all the fun with my husband. So to me ऐसा नहीं था कि हाँ अभी next chapter is the baby. But then once we planned and when things turned out so good, so then it was like कि मतलब अभी तो full focus यहीं पे. And also in the labor room when you told me कि congratulations it's a boy, I was like girl ना, तो नहीं, you are like no it's a boy. So I was prepared. In fact I had thought of a name also for a girl. So
But it's never too late. We still have one or more opportunity left.
I am truly invested over here right now, physically, mentally, emotionally.
Yeah, time है अपने पास, कल का कल थोड़ी. But baby girl, next. Okay, now 5 things to all the parents out there who are thinking and scared of traveling with a newborn.
See,
Five
as you
advices you'll
said,
give.
right now hydration is the key. In fact, I keep a bottle filled with me all the time because when I am feeding my baby, I get this craving of having water. I keep on drinking water. So obviously, carry your water along and make sure that you are wearing clothes that are comfortable to feed because you see, I have totally become a boy mom, shirts and t-shirts and bye bye to dresses. So, and yes, carry colic medicine and all. My baby was not colic, but still, from my pediatric, I got the name of the medicines and all. And I used to carry, I still carry with me in case he becomes cranky or something.
Plan a trip which is baby friendly.
See, select a very good location where the baby is going to be comfortable. Extremely cold, extremely hot weather.
Does not
Obviously,
work.
baby is not going to set that easily, na.
Yes.
So a very good environment जहाँ पे baby will feel normal and a good property is very important.
Yes. Another thing that you said is please carry all the medications. We want our child to be very safe and nothing to go wrong, but always carry basic first aid kit with you because we don't know how far the medical services are or at what time of the day or night you may need some medication. So take your simple basic routine medication but always carry it with you. So that helps. That goes for you also. As a mother, you also need a certain medicines to be there because that moment you may not find a doctor nearby.
You have this implanted it in my brains. Calcium to lena ही है. So I have set an alarm at 10:30 exactly at night. Without fail, I have my calcium tablets because I have observed this thing. If I'm skipping by mistake for 2 days, my knees hurt very badly, and I'm like, हाँ मेरा calcium जा रहा है ना. So calcium, and then I carry a paracetamol just in case, but then I never had to take one.
Great. So now we move on to rapid fire. Okay. So traveling with babies, without babies.
With babies, any day.
Okay. Morning person, late night.
I was a late night person, but now my maternity leave is over and then I moved to school, so
Okay. The mother work or resuming work, which one was more difficult?
resuming work because I have to leave my baby behind. But then it is very much needed to get out of the house for your own sanity.
Yes, that is a very good thing because the guilt factor of leaving your child. But once you are happy, only then you can make your baby happy.
Exactly, yes. And then I know people at home are going to look after my baby as much as I am going to take care. So obviously the guilt is there. I have the CCTV installed. I keep on looking. I keep on FaceTiming. But then,
Works.
nahi, हाँ,
And how do you compensate the away time from your baby once you come back?
lots of cuddles. He is a cuddly baby. He loves cuddling. So even once I am home now, then he will cling to me, and I can see that he is very much happy to have me around. And likewise,
Now tell me, how difficult was it to wean your child?
see, I had to start with solids because I was resuming work and I did not want to give him formula milk, and I'm not pumping also, and I did not, dairy milk is not an option only. So, but when we started, now we were seeing that he was eager. He used to look at our plates, and he had started identifying that this is something that you eat. So when we fed him the first spoon, so at that time it was a very emotional moment because abhi independent ho raha hai, he would need me lesser and lesser. But then I love how he accepts everything. I've been giving makhana porridge, dudhi, whatever I give him now, he accepts it very nicely. So
Nice. Now, where is your next travel plan, baby?
I'm waiting for my May vacation, summer vacation to begin at school. So
Then planning a trip. Great. Thank you so much. Thank you so much for taking time out, for answering our questions, for helping all the parents who are confused and who are contemplating, who's finding it very difficult to manage a baby. So your insights have been very helpful.
I wanted to ask you whether, like, are all the pregnant moms like we want to travel and asking for permissions, or is what like was it just me?
They want to, not as much as you. probably once baby moon if everything is okay. So that's what, if there are no complications. As a doctor, we also want you to travel. We don't want you to get bored down or start hating the whole pregnancy part.
In fact, I remember you telling me this is not a disease, this is a period. Now you enjoy it. So yeah, it is a phase to be enjoyed.
Yes. So that's also, then that may, first and foremost, it brings you as a couple together. You're ready for the next chapter of your life. So unless medically contraindicated, we obviously encourage at least travel nearby. And with the baby also, like you said, for 6 months ideal time, because very less requirement. But that only helps or work when your baby is as cooperative as your was. So if the babies are getting frequent sick, or if they are not doing at the well health, or the feeding issues, so every pregnancy, every delivery, every baby is different. But yeah, if
But
it's
I
all
think
normal.
doctors should promote baby moon, because I see the change in our relationship as a husband and wife. What we used to be before having the baby, you're totally carefree, doing your thing, and now you have the responsibility of a child, and everything you do is now going to be about the child and around the child. So, yeah. And even today, if we go somewhere, at least for a few hours, or maybe just if our baby sleeps, when we have us time together, we scroll through the photos of the baby, we see his videos. So if he's sleeping just next to us, and we keep on looking at us, कितना cute बच्चा है यार, ये अपना है. So
Yeah, life changes.
yeah,
Full
life
180
changes,
degree
huh? But
changes.
then I think baby moon is the time when you connect as parents, because when you start talking about things, we will do this for the baby, we will do that.
So baby moon,
Yes.
compulsory.
So now the journey has been so beautiful with you. Like, ऐसा लगता है हाँ और बच्चे करने चाहिए. It has been a fun experience throughout.
Excellent. So I'll wait for your second baby. But 3 साल के बाद, अभी नहीं. You still have 3 years to go ahead. 2.5, we'll work around it. But how was the experience starting, resuming work?
Total fun. And I've been getting compliments, like they tell me, लगता नहीं है तू बच्चा पैदा करके आई है. And so, in fact, other day one of my teacher told me कि मेरे दोनों cesarean हुए. Okay, my colleague told me. So मेरे दोनों cesarean हुए and you are going to have back pain. And मेरे दोनों normal थे, cesarean में तो back pain होता है. तो थोड़ा flow हुआ conversation, and then I was like, आपको अभी भी back pain नहीं होता है ना? तो she was like, हाँ अभी तो मैं 45 की हो गई ना. So then I was like, नॉर्मल में भी होता है आपको? तो मैंने बोला मेरे हस्बैंड का भी होता है, उसने सिजेरियन नहीं किया. So people look down upon C-section, which I don't. मतलब obviously once you are going to age, what is going to change? कुछ तो होगा ही.
So no, it's all about how you take care of yourself. One thing that I always say is, you have an army to take care of the child, but after the baby is born, you are taking care of yourself.
They tell you need a village. So my husband is in my village. You have to make it compulsory for all your patients.
Yes, definitely. Thank you so much, madam, for giving us your valuable time and taking time out from your busy work schedule.
Thank you for giving me such a wonderful baby.
Yes, and we have a small token for you. So this is from us. Thank you so much.